There was obviously in place a ban on plastic bags in many parts of the country well before this coronavirus pandemic. We're in quite uncharted territory. It's just been a few weeks. How seriously had those bans been impacting the plastics industry?
I think it's a good start. I'd like to see a lot more impact on the plastic industry, to be honest. But it's been really inspiring seeing all over the country and really all around the world people in communities of all sizes rising up and saying, we want to protect ourselves, we want to protect our oceans, and we want to start getting rid of single-use plastic.
So, what have you been seeing in terms of the claims that people are making about the plastic bag ban? I recall even before the coronavirus hit, it became a sort of favorite target of conservatives to slam, plastic straw bans. Trump made a big deal about it. But are you seeing a lot of these kinds of claims that now is the worst time for us to have a plastic bag ban because coronavirus?
Yes, we are. And it's really just in the past, I'd say 10 days where this has completely taken off and it's become a major corporate initiative to try to undermine these efforts that people have made all over the place to try to limit plastic in their neighborhoods and their communities. And it's very rare that we actually see companies being willing to put their name on this. It's much more often through front groups and trade associations and lobbyists. And most recently, we have now seen plastics, the Plastic Industry Association, trying to get the Secretary of the Department of Health and Human Services to come out and say how important single-use plastic is to protect human health and to actually advocate against bans at the community or state or even federal level.
Now, there is obviously a place for plastic, particularly in the medical community, as there is a massive shortage of personal protective equipment. I imagine that plastic is at least one ingredient in many of the masks and gowns and gloves that doctors and nurses rely on. And of course, a lot of equipment does need to be disposable in a medical environment to prevent contamination.
I think that's probably right. I mean, as we learn more about the long-term impacts of our addiction to plastic throughout the history of its life cycle, from production all the way up to disposal, we'll probably want to find fewer and fewer uses